Hello and welcome. You found the Social Work Podcast. My name's Jonathan Singer, and I'll be your host as we explore all things social work. Hey there, podcast listeners. Jonathan here. Really excited about today's episode. I get a chance to speak with Dr. Jessi Gold about her 2024 book, How Do You Feel? One Doctor's Search for Humanity in Medicine. Dr. Gold's the first Chief Wellness Officer for the University of Tennessee System, a role encompassing 5 campuses across the state of Tennessee and over 62,000 students. She also serves as an Associate Professor of Psychiatry at the University of Tennessee Health Science Center. As a provider, her patients are other providers, which gives her a unique perspective into the experience of workplace burnout and wellness. And in today's interview, we talk about how during the COVID-19 pandemic, she found herself giving hundreds of lectures to the providers in this system on burnout prevention, only to realize that she herself was burned out. We talk about the symptoms of burnout, how the healthcare system incentivizes providers to take pride in the very things that can lead to burnout, and how she found healing through writing. We end with her very practical advice for social workers who want to write about their own workplace experiences. Now, I found her book to be a powerful, honest, and often funny exploration of mental health and well-being, both in and outside of healthcare. In her deeply relatable and beautifully written memoir, Dr. Gold shares stories from her own journey in academic medicine and those of her patients, pulling back the curtain on the often toxic culture of healthcare that expects resilience in the face of trauma and burnout. With wit and vulnerability, she challenges us to rethink what it means to truly care for others and ourselves. And whether you're a healthcare provider, like most of the folks who listen, or you're a caregiver, again, like many folks who listen, or simply someone who's trying to balance work and life, this book is a must read. Dr. Gold reminds us that while systemic barriers remain, there's always room for hope, healing, and finding meaning in the work we do. Now, without further ado, on to episode 141 of the Social Work Podcast, How Do You Feel? An interview with Dr. Jessi Gold. Jessi, thank you so much for being here on the Social Work Podcast and talking with us today about your book, How Do You Feel?
Thank you for having me.
So I love the cover of your book. It reminds me of an Eric Berne kind of 70s throwback. What inspired you to take time out of your busy life as a psychiatrist to write this book?
I never was like, I need to write a book. But what I did experience was a very unique time period that needed to be processed in some way for me. I had been a psychiatrist for healthcare workers and college students in the middle of the pandemic, and it was a hard group to be seeing and a hard group to be seeing alone. And I was processing that in therapy, but also had been an expert on TV and an expert in my work life and like my hospital system on these topics, and was like, people keep asking me this stuff. I think that like people want to know more about this and they want to feel like seen and understood. And I wrote some little pieces on it, but then kind of felt like there was more to tell and I wanted to be the person telling it, because I think I have a unique perspective on it as a psychiatrist who sees healthcare workers and also works in that administrative kind of role on wellness. And so I'm not just doing the leadership aspect of it, I'm still seeing those people clinically, and that unique perspective plus my own sort of personal experience with depression and burnout, I felt like really told the story in a way that humanized us differently and explained it differently than I could have with just research or something. And so it started off probably as a way for me to kind of figure out how I felt about the whole thing, and wound up being a way to hopefully help other people figure out how they felt about the whole thing, and maybe feel a little seen and less alone with their experiences.
Well, I'm glad that you did. Um, and I really appreciate your perspective as a mental health professional and somebody who works with mental health professionals. And going off of what you just said, your book does a beautiful job of presenting, I think, what some people would acknowledge as kind of the striking paradox, which is that the very qualities that make healthcare professionals effective, like empathy and dedication and self-sacrifice, are also the ones that make them vulnerable to burnout. So, how do you define burnout? How do you understand burnout? And how do you reconcile this tension, right? And what are some of the insights you've uncovered about maintaining your humanity and sort of the humanity of professionals in a system that often demands so much of us?
Yeah, so I think burnout has become one of those words that is just kind of co-opted and not always used appropriately, like so many mental health words, where people have kind of grown to using it to just mean like work was hard or something, but it's so much more than that. And I think, in medicine and healthcare and mental health work, we have this expectation that work is supposed to be a lot of the things that burnout makes us feel. So burnout being a constellation of three things, where like the first is emotional exhaustion. Find me a mental health practitioner who's not emotionally exhausted, right? And so that's sort of just feels like that's the way work is. And then depersonalization is the second one. And like in a lot of ways, I think so many of us learn to do that, to sort of remove ourselves from the situation in some capacity, distance ourselves to the stories that our patients or clients are discussing because it's protective. And so we say, oh, well, we're just doing that because that's how we protect ourselves. But, it becomes sort of pervasive, and we're doing that in a way where we're so distant, we don't even really think about them as people, and we're just kind of going through the motions. And the third one being like a reduced sense of personal accomplishment. As a person who cares a lot about my personal accomplishments, that's the one where I for sure notice, but it's also the one where a lot of people notice and come to me as a patient and say, like, someone else pointed out I wasn't doing X, Y, or Z at work, or I noticed I wasn't doing something at work. And that is a point in time where we start to worry that someone else might say we're not living up to our expectations in the workplace, and less about just sort of how we're experiencing work and how we're feeling around work and after work. And, for me, I didn't know I was burnt out until really someone else told me I was burnt out, which really told me that I could run around giving 700 lectures on burnout and all of the symptoms like I just rattled off for you. And I was really bad at applying it to myself. So like, if I, as like a burnout expert, couldn't do it, why should anyone else, And, for me, I was falling asleep like every day after work, like this kind of sleep that I couldn't even fight. Like I'd wake up 4 hours later. And I think that feeling, just I was certain it was a physical illness, or I was certain vacation would help. And like none of that was true. And really, my personal therapist is the one who really identified and named it for me and called it burnout. And it was almost like I laughed because I was embarrassed, because I literally, like, when I say 700 lectures, I wish I was minimizing like or maximizing it and saying like too many, but I'm actually probably minimizing it. And because I was going around to like every division in the hospital and talking about these things. And so it would be like I just lectured the day before, and then she was like, hey, you have that. I don't know what you're talking about. And so I think for me, like, symptoms and being able to rattle them off and then actually experiencing it and being able to identify it are two different things. And I see it that way now in patients too. And I think that, when you look in healthcare, you look in our work, and you see kind of people next to you all sort of looking and experiencing the same stuff. It's like a normalized burnout where like everyone just looks a little emotionally exhausted and depersonalized. And you're just kind of like, maybe that's how I'm supposed to feel. But just because we all feel like that doesn't actually mean that's the right thing, And so I think when I think about why I'm burnt out beyond sort of the systems factors, which I know in social work too, is like things like notes and things like insurance companies and things that are frustrating and kind of systems problems. There's also for me this like when I'm so frustrated or when I'm so tired, I can't protect myself from people's stories as much as I would like to. Like, I can't not think about how dark the world is and how hard the world is. And I'm a empath, as however you define it. And that I think makes me good at what I do, but also makes me feel like a lot of things when I'm not able to prevent myself from feeling those things. And then if I do prevent myself from feeling those things, I often, like, if I'm burnt out, it'll be the extreme, right? Where it's like, well, now I just am totally removed and not really paying attention as much as I should. And I'm not doing work in the way that I would want to do work. And so finding the balance is hard, I think. Like, it swings pretty quickly from like being distant in a way that feels right to you, in a way that you've practiced in training, to being too distant or being too involved, right? And trying to maintain that sort of balance has been something that I have to like actively pay attention to now and start to notice earlier, which is hard. Like, the signs of it are not like glaring all the time, and sometimes for me are as small as like a patient inbox being something that really really agitates me in this way that's like beyond the normal scope of like what a patient inbox should make you feel. And that to me is an early warning sign, much beyond, like much earlier than, the falling asleep every day after work, and trying to notice that stuff before it becomes too much has been a large part of me trying to deal with coping with the work and how the work makes me feel, and also still doing my job the way that I want to, and want to feel I can.
So you've raised so many interesting points to follow up on. One, I just have to say, I love how you talk about depersonalization, as sort of one of these three components of burnout. And immediately made me think of the way that it is reframed, which is compartmentalization, right? Mm-hmm. We're told, oh, you just need to like create this box and like put all this stuff there. And while that's true, the kind of the worst possible outcome of that is that experience of burnout, right? Which is not just like, oh, work is tough, right? It is way beyond that. And so you mentioned a couple of things that sort of you recognize as kind of like warning signs for yourself. But in terms of the kind of the broader solution, which is to not lose who you are as a person in the work, right? To be able to bring yourself and your feelings about things, your genuine experience. What advice do you have for mental health professionals who either are just starting out or who've been in the field for a long time and might be struggling with burnout about this idea of maintaining your humanity?
I wish there was a perfect answer to this. I wish that I had like completely figured it out, but maybe because I haven't, that's part of it too. But I'll say that we're taught that we shouldn't be self-disclosing, that we like shouldn't be humans, almost, that like somehow we're supposed to, like in psychiatry, be Freud and like this blank slate where like nothing about me, and that makes you better because you can feel healed that way, because whatever I am is a reflection of whatever you want me to be. And I've never bought that. It never felt right to me when we were learning it in training or school, or medicine tried to tell me that was the way I was going to feel safe, was like to be stoic. And I was like, that just is so inauthentic, and authenticity is a core value for me. And so it just like really rubbed me the wrong way. And I think sometimes you have to do some things to survive training because of supervisors, because of hierarchy, because of rules that, maybe go against what you might want to do in the future yourself. But I do think that as a, psychiatrist myself, I've found that patients respond more to the fact that I am not a blank slate, to the fact that they could Google me and find some stuff, that I have a social media profile, that I write about my own experiences. I still use boundaries in a patient setting a lot. I'm not going to just talk about myself. But I do, if it makes sense, like if it's a person struggling with something similar to me and it would benefit them to hear about something I've done, or I might say, I know someone who, and it's actually me. But I'm not like overly disclosing in the one-on-one sort of encounters, but I do believe in it. And I do believe in it as a way to protect yourself, because if you kind of just become this like tool doing the work instead of a human doing the work, it just doesn't work like that. Like it's always going to affect you anyway. So you might as well acknowledge that and recognize those things in real time so that you can process them at the end of the day, so that you can talk to a therapist about them, so that you can deal. Because it makes you better. I think patients come to me for the way that I am. And so like, it's not a great piece of advice, I suppose, but I would tell people to do what feels right for them and their patients and what they're doing. And sometimes people might not agree with you in training and things like that, but figure out what feels right for you. And, boundaries are important, and they are really important with certain kinds of patients, especially. So I'm definitely not saying just like full on go complete self-disclosure all the time and like become friends with your patients. But I am saying like, you're allowed to be tired sometimes. You're allowed to be sick sometimes. You're allowed to be affected by what someone tells you sometimes. Like, pretending we're not is not helping.
Well, and you write about this in your book, and I'm wondering if you can talk a little bit about your journey, right? If you can tell a little bit about your story.
For sure. I mean, I think for me, it's not like a light went off and I realized that like work was affecting me, but so many of my patients are so similar to me that like it's a joke to pretend that they don't affect me. Like, we talk about countertransference, obviously, and talk about how that can play a role in how you feel about a patient, or that sort of thing. But I don't know that we talk as much about just like hearing their stories over and over and over. So if you're me and you're home as a non-emergent healthcare worker in the pandemic and not frontline worker per definition of a hospital, and you're just seeing patient after patient after patient after patient on a screen, and all those patients are frontline workers, and you see what they're experiencing, you worry about your friends, you worry about their safety, and at the same time have a ton of guilt that you're not actually in the hospital too. That all sort of compounded for me in feeling just like, I mean, every story felt like it was the same thing over and over, and that I wasn't helping anybody. And helping people get better, or take a step towards feeling better, was so important to like how I defined what work was for me. And being home by myself too, I was like, oh, I'm not good at my job anymore, and I'm also alone, and this is miserable. And I wasn't depressed, because I've been depressed before, but sort of realizing how much listening to that over and over and over was affecting me. I think having lucked out in having a therapist that started in January 2020 with me was probably the best thing that ever happened to me, because kind of as I was trying to figure some of it out, like what I was feeling physically, what I was feeling emotionally, how I was feeling ineffective, how I was feeling guilty, I had someone to talk to about that the whole time and once a week. And it was like, honestly, the most, like the person I saw the most during the pandemic, right? Which is super weird, but critical to how I sort of grew in understanding how much work affects me, how much I like beat myself up if I can't help somebody, because somehow I'm like gonna be the perfectionist who can always do that, as if we can always do that, as if listening to someone isn't healing too. And worked with her a lot on how to cope alone, right? So I am an extrovert. I didn't even realize how much being around people was important to me dealing with work. And I just felt like in a work hole without people. Like, all I was doing was work. Everybody at work was like hard and not getting better. And I had no like coping outlets besides talking to my therapist. And so, like, with her, I had to really learn like what I could do by myself to cope. And like sometimes that's journaling, sometimes that's just having like stress balls and stuff on my desk, sometimes that's watching stupid TV, like whatever it is. Being able to do that myself and not always rely on other people because they might not always be there was a big part of the growth in this all for me. I think like that patients actually counted as people for me, but in this time they were just contributing to sort of my perpetual state of feeling like the world was depressing. And so I needed an outlet that didn't feel like that as much as I could. That was like self-controlled, I suppose. And so trying to get better at that was like a lot of the work for me during the pandemic. I mean, I think probably people listening either had to do that themselves or explain that to clients or patients and wouldn't be surprised by that, I guess. But sometimes I think it's funny when we like are doing the same work that our patients are, but I think that just shows like how there isn't a big difference between us, you know?
Yeah, I mean, I know that I remember talking with Carol Tassone about the concept of shared trauma, right? When you and your clients or your patients are going through the same thing. Now, what you described about them being, you know, your patients, your clients being frontline workers, and you were not technically a frontline worker, but certainly, you know, it sounded like there was some secondary trauma from hearing their stories and really from not feeling like you were able to help, right? That sense of helplessness, which mirrored their own experiences of this thing. Right now, we're talking about the early days of the COVID pandemic, where it was like people were dying and nobody knew what to do. So, what do you think from your experience and what you learned in therapy? How can mental health professionals navigate these pressures to be perfect while allowing themselves the freedom to make mistakes? And what would it take to transform these mistakes into opportunities for growth rather than sources of shame?
Yeah. I mean, so it starts early, right? I mean, I write a lot in the book about sort of where I became a overachieving perfectionist. And for me, like, I don't know, I liked getting good grades and I started at a really young age and you get positive reinforcement for being the smart one, for getting good grades, for getting into things, for, you know, whatever had to do with academics. And I just thrived on that. And I don't know that anyone ever explicitly told me X, Y, or Z, but it was modeled. Like my siblings all went to really good schools and they were older than me, or some of them were. And my dad was a psychiatrist too. And so like the air that I breathed told me I needed to do well in school. And that I think translates later to work because that's the place where you have some sort of objective measurement of work equals success or something, and maybe feedback in the same way. Like, you know, if you do well, you get good feedback. If you don't, you don't. And so it reinforces this concept of like not making mistakes and being perfect. I think competition also gets in the way there too, right? Which is, you know, to get into med school, to get into residency, all these spaces, there's like a limited number of spots. And so you learn not only to do well to get even like considered, but to do so well that you beat everybody else. And that really does require a level of like sort of perfection because of what those schools and all of that like ask of you. And so you kind of have competition plus this like overworked sort of desire to get good grades, et cetera. And you carry that into the workplace and you say, well, one, any error will make somebody beat me and be better at their job than me. Two, any sort of thing that I would admit as a fault, including my own mental health, would make me have a weakness that other people could prey on or could make me less competitive than somebody else. And so I'm going to hold that in, or I'm not going to talk about it because I don't want to be preyed on for this, or like, I don't want this to be what distinguishes me. And so you keep a lot of things to yourself and also try to just keep going. And I think what happens as a result, and there's a good paper I read sort of comparing elite academics to elite athletes. and looking at when Simone Biles originally kind of like stepped back and how like it would be very rare for us to have stepped back in the same way, because that would be seen as something where someone could beat us, and we don't like that. And so our when we fail, or whatever word you want to use, it is a harder fall because we almost like don't prepare for it or expect it. We almost assume the other thing, that we will never fail. um in medicine too, there's some studies on a concept called self-valuation, which is like, when you make a mistake, is it your fault or is it a growth opportunity? And people who are doctors are like substantially more likely to say it's their fault. And I think that can be worked on, right? Like, just like self-compassion can be worked on, like how we conceptualize mistakes and what our brain tells us afterwards, or what our brain tells us when something doesn't exactly go our way, is important in like a cognitive behavioral therapy way, honestly, to be able to say like, well, what was that thought, and where did that thought come from, and how do I reframe that thought, and what's the evidence for that thought? Because we don't pause. We just let those thoughts be. And we just let the angry thoughts that tell us we're stupid and horrible doctors and horrible people, like, be the thoughts that echo in our head. And so the reframe and the pause, I think, is really important. And actually hearing those things out loud that we say to ourselves. And so with my patients and with me, I think self-compassion in particular is a really important skill to work on, to be able to manage day to day in the workplace and acknowledge our humanity within it, and see that, like, just because we couldn't get everything done, or because we like had an error, or because something happened, because the people we also see are human, that's not on us. Like, it's not bad that happened. It's just truth that happened, and you can kind of go and learn and grow from there.
So your book talks about your experiences, and I think it's really well written. It's very engaging, and it actually kind of reminds me in tone of one of my other guests on the podcast, Lori Gottlieb, who wrote about her therapist and wrote about some of her clients. And I think one of the things about effective social workers is this idea of being curious, right? About being genuine and really engaged with the human experience, right? With what their clients are bringing to them. And as you've said, not just kind of going through the steps and kind of moving people along. And I think there's a very small group of social workers that would love to write about these experiences outside of the medical record, right? Not just doing progress notes. Of course, we're told, don't share private information about your clients, for very good reasons. I mean, I've seen therapists, I would never want them to write about me in a way that people could trace it back to me. So I'm wondering, what advice do you have for mental health professionals who want to write about their experience, the stories and the insights from their clients, and the experience of going to a therapist?
Yeah, I mean, I started writing because I had to. When I was in med school, especially, I just felt like I had a lot of thoughts about the things that we saw and were experiencing, and nobody was talking to us about them. They were just like expected, or sort of like you're supposed to just go to lunch afterwards. I had an attending kind of trick me into cardiac massage on a patient that was already dead, meaning like we were in this emergent situation, and he called me in to help to actually physically pump the heart. And I'd never even touched a heart at that point, and beyond like anatomy lab. So that's not a live heart. And I didn't really know until after that, like, that was sort of a, not like the patient was already dead and he wanted me to learn that procedure under duress or something. And I felt like so angry and like hurt. And that's the first time I ever wrote to like give myself a voice, like to process the things that were in systems that I couldn't control and felt frustrated by, but wanted to fix, and nobody could like hear me or listen to or fix. And so I wrote about my experience as like the expert of my own story. And then I got a lot of positive feedback. And that's the first time in medicine I'd ever really gotten feedback like that, because medicine's not
Wow.
meant to be positive. And I was like, oh, like we can use our experiences to make people think differently and to cause change and to maybe do something we couldn't just in a clinical setting, you know. And I hadn't really ever thought about that. I mean, I didn't do journalism in high school or college. I just like sort of fell into it in my own way to deal with things. And I think a lot of people who do what we do maybe might fall into it that way too, because we're observers of the world. And sometimes the world is frustrating and we feel like we don't have a voice. And I felt like writing gave me a voice. And I feel like in return, sort of, I can give my patients one. A lot of the things that I've chosen to write about that at all include patients are things where like 100 patients have said the same thing to me. So obviously people are struggling with it and they don't have access to psychiatrists. Like not everyone has access to psychiatrists. So I can explain it to as many people as read the things that I write, and maybe people who wouldn't have access now do. This is the first time I've ever done composite patients, meaning the stories are all real stories, but some of them like are put together into a person. Like the person is not that exact person. Like Luke is not Luke in the story, or Megan isn't Megan, but I've had enough patients with the same kind of background, and I did enough interviews for this too that I put them together to tell the story. And it's not like made up, it's just preventing people from being able to be identifiable and still telling the common struggle. I will say, as a as a person who both wants to protect patients and also finds it hard to change details, because the details are what's relevant in psych in so many ways. Like because of their background as an X, Y, or Z, that's why they're experiencing X, Y, or Z. And I had to kind of like pull myself back from that and try to remember like, well, what parts of that are what's key, and could that be true of someone else with a different background, to sort of like, protect them. And writing about them, I think, gives their stories and their experiences like voice, but also lets other people who clearly are experiencing that but haven't had the chance to tell anyone or feel alone in it, like a mirror too. Writing about my therapist is a whole different thing, because I still see that therapist, and through this whole process she knew I was writing about her. And sometimes, and maybe this is such a psych thing to say, like I would be like, she's going to dump me as a patient. She's going to think I'm creepy. Like who writes about their therapist? And she would say like, I never wanted to write and I never wanted to be famous for like, the work that I'm doing. I just wanted to see patients. But because what you're trying to talk about is healthcare workers, mental health, and you are a healthcare worker, it makes sense that you include your therapist. Like it's almost a lie for you not to, because it's such a big part of how you deal and how you cope and what you've chosen to do, and modeling that matters. And so it's almost like she could see the purpose, the grander purpose of like me writing about it outside of her, and there are lots of times where I tried to get her to read stuff early, and she said like, I don't want to read it when I can make edits, because it's your version of a story and it's your story, not mine. And I think in so many ways it mirrors what brought me to writing in the first place, which is like giving experiences a voice and being a place for advocacy. And like, I feel lucky that my therapist can see that and doesn't feel like embarrassed or threatened or anything by it. If anything, it's like basically a gigantic thank you letter to her, and maybe a little creepy because I like her so much. But it's probably nothing I haven't said to her in person. So I think, if you're interested in writing about these things, like take a shot. I think there's lots of things that'll feel confining, like having to change stuff to really like tell the story, but you also know why you're doing that. And what's really at the core of it is these like themes, right? Like in my med school experience, it wasn't that person that did that to me. It was that mistreatment is still really common in medicine, right? That we do those things without thinking about what it's like to be the trainee, that we think it's a good idea, but we didn't actually ask them or ask them how they feel, right? Like inherently with these patients, the things that you're thinking about are probably applicable to other people. And it's the broad themes that are making you interested or angry or emotional. And like, that's where you kind of have to lay your hat, but it's there and you can still help people that way.
Yeah, I love that idea of over time recognizing commonalities, themes, experiences, and then doing the work of creating a believable composite, right? Mm-hmm. And sort of having some internal consistency, like Luke, who, even though I read in the beginning that you had created a composite, like I was still envisioning a person reading about Luke, right? So I thought you did a great job with that. And I also appreciate that your therapist said, this is your story, right? This is not something that I want to make edits on. It speaks to what good therapists do, which is that they recognize that part of what helps people get through, the trials and tribulations of life is having a coherent narrative that that makes sense to them and that maybe doesn't, inappropriately make them the hero, but makes them a compassionate character, and to write a book which is about the experiences of healthcare workers dealing with burnout, dealing with all of this stress, and not to go through your own story. I think you're right. Like it would have been disingenuous to not include that. So I appreciate you talking a little bit about your process in writing about that. And I hope that that's helpful for folks who are listening who would like to do the same thing.
It's all kind of meta because it's like you're a therapist in therapy writing about therapy. Like it's just like there's a lot of layers to it, but I mentioned how much authenticity matters to me. And I think my therapist knows that too. So being able to show that part of me as a human matters. Like I told you that was such an important relationship for me, figuring out how I felt about things, especially during the time of the book. And it would feel weird to not have written about that.
So Jessi, as we wrap up, is there anything that you learned while writing this book that surprised you?
I think I surprised myself that I needed to still write it, if that makes sense. Like I'd been processing all throughout and was like convinced that I was fine. Because it wasn't like I was ignoring it, because I was talking about everything in real time. But the reflection, like starting writing about something that happened, I didn't write it immediately in real time, gave me like such a different perspective on it and was healing in a lot of ways. And I don't think if you would have asked me, like, if I would have thought it would have done much else than like what therapy had already done, I think that surprised me, that like going back and thinking about it and reflecting on it and thinking about how patients affect me and what about patients makes me think would have made, such a big impact on my own mental health. But I mean, it did. And, in talking to my therapist, even with the book, like what's a measure of success, right? So there's obviously objective measures, which you have no control over. You can do things like come on this podcast, right? But you can't control if people buy it. But, just like you can't control how people feel about things, but you can control like what you learned and what happened to you as a result. And I think what I just said, like, I feel like I understand myself a lot better and understand that time period a lot better than like I ever could have otherwise.
I'm glad that you had this additional layer of kind of insight and healing that came through the process of writing. And I know that there are folks like Pennebaker out of Texas who've written about the power of writing to address trauma. And I think that that's certainly something that we allude to when we ask our clients to journal, even though some clients, like you acknowledged yourself, not particularly liking homework in therapy. I do think that when folks recognize the value of doing something outside of the session as sort of helping them reach their goals, it means a little bit more. So I appreciate you writing your book for us about your experiences. Like I said, I think it's really well written. I think it's really interesting. Anyway, thank you so much for being on the...
I think I just wanted to say to people listening, like, thank you. I think that we take for granted the work that you guys all are doing. And I try in my job as an administrator to make sure that we're actually thanking people and not just like throwing a pizza party or giving some kind of stupid gesture, but really, really thanking people. And I think that we don't get that a lot. Like even our patients, like it's very rare to be thanked by psych patients, maybe because of boundaries, maybe because of their insight, whatever. And I think a lot of the hard work that we do is underappreciated. And so if anything, in writing this book and in having this conversation, like, I just want people to know that like, it's okay that work affects you. It's okay that you have feelings about it and you're still good at what you do and should be appreciated for it.
I love that. That is an inspiring way to end this interview. So, thank you, Jessi. Thank you for taking the time to be on the podcast. I really appreciate it.
Of course. Thanks for having me.
I'm Jonathan Singer, and thanks for being with me today for another episode of the Social Work Podcast. If you missed an episode or have suggestions for future episodes, please visit socialworkpodcast.com. If you'd like to support the podcast, please visit our online store at cafepress.com/swpodcast. To all the social workers out there, keep up the good work. We'll see you next time at the Social Work Podcast.